Hi, my name is Vanessa Aguirre. I'm a student at Baylor University for nurse practitioner. I will be assessing Anthony today. Do you have any questions before we begin?
I don't.
Okay, perfect. So I'm going to perform hand hygiene. Okay, hand hygiene is done prior to the exam. I'm going to get consent from my patient. So Anthony, are you okay with me touching your hair, face, ears, neck throughout this assessment?
Yes.
Okay, so consent is obtained, and I'm going to go ahead and start my assessment. So general survey, we have a 6-foot male here. He is Hispanic. He is breathing even and unlabored. He has no signs of discomfort. He's answering questions appropriately. He has good hygiene and his hair is well maintained. So now looking at his overall skin, color is appropriate for his skin tone. Skin is warm and moist. There's no lesions or bumps noted at this time. I'm going to go ahead and look at your capillary refill. So capillary refill is less than 3 seconds, so it's brisk. Nail beds are flesh tone. Nails are cut nicely and maintained, and there's no clubbing noted at this time. So now I'm going to go ahead and touch your head, okay?
Okay.
So feeling around his skull, it's atraumatic and normocephalic. Hair is appropriately combed. There's a small buildup on his scalp that could be from dandruff, so we want to recommend a dandruff shampoo for you, okay?
Okay.
No bumps or lesions noted on the skull. Now we're going to go ahead and move to his face. So his face is symmetrical. His skin tone is appropriate for his color at this time. No jaundice, cyanosis, or pallor noted. Skin is moist and intact. Now we're going to go ahead and move on to his nose. So nose is symmetrical. There's no deviations noted from the outside. So I'm going to go ahead and look on the inside. Okay, no blockages noted that prevent from normal breathing patterns. Could you breathe? And on this side. So nostrils are patent. Patient's able to breathe on both sides. Now we're going to go ahead and move on to TMJ. So for this exam, I'm going to ask you if you feel pain after, okay?
Okay.
So I'm going to put my fingers on the base of your jaw. Can you open for me and close? Okay, perfect. So do you feel any pain?
No.
So patient denies pain and there's no clicking or grinding, which shows normal for that. Now we're going to go ahead and move on to sinuses. So I'm going to go ahead and palpate around your sinuses, okay?
Okay.
Let me know at any time if any of this hurts.
All right.
Any of that cause any pain for you?
No.
Okay, so sinuses are non-tender at this time. So now we're going to go ahead and move on to his ears. So on his ears, I would use an otoscope to check for buildup of drainage or cerumen that would cause an ear infection. I would look at his auricles and trachea to make sure they're intact and symmetrical, which they are. Okay, so now we're going to perform the whisper test. So I'm going to have you cover your left ear, Anthony,
All right.
and I'm going to whisper a 2-word syllable into his right ear from about 1 foot away. Can you repeat that word for me?
Water.
Okay, so now we're going to do the other side. And from 1 foot away, I'm going to whisper another word. It's going to be, can you repeat that word?
Water.
Okay, perfect. So both ears, he can hear bilaterally for the whisper test. Next thing we're going to do is the Rini and Weber test. We don't have the tuning fork with us at this moment, so we're going to walk through the steps. So for the Rini test, you would take the tuning fork, you would hit your knee with it so that it starts vibrating. You would put it on the base of the mastoid bone, and the patient should hear air conduction twice as long as the bone conduction. Then for the Weber test, you would strike the tuning fork on your knee again. You would put it on the top of the patient's head, and he should be able to hear symmetrically the vibrations on both ears. Okay, now that the ears is done, we're going to go ahead and look at his eyes. So eyebrows and eyelashes have hair and are well maintained. His eyelids are able to open and close appropriately, blink at a normal pace. No lesions noted. I'm going to go ahead and look in your eyes, okay?
All right.
Okay, so eyes pupils are about 4 millimeters, and they constrict to about 2 millimeters when light is shown. Conjunctivae and sclera are white. Cornea is clear. There is no abrasions noted on the outside of the eyes at this time. Okay, Anthony, I'm gonna go ahead and perform a test. It's the extraocular movement of your eyes, so I'm gonna have you follow my finger.
Okay.
Try not to move your face or your neck, just your eyes, okay?
Alrighty.
Okay, perfect. And now I'm gonna push my finger up into your by your nose and then back. It's just to check if you can focus on objects at various distances, okay?
Okay.
Okay, perfect. So eyes look great. So now we're gonna move on to oral, lips, and mucosa. So lips are a little dry, so we'll recommend a lip barrier for that. Can you open your mouth for me, Anthony? Now can you say ah?
Ah.
Okay, so uvula rises when patient says ah. Palate gums are pink, moist, and intact. Dentation is great. Okay, I'm gonna go ahead and feel around your neck, okay?
Okay.
Trachea is midline, no deviation noted. Do you feel any pain when I palpate your lymph nodes?
No.
Okay, so lymph nodes are non-palpable and non-tender at this time. Thyroid gland has no masses. Okay, can I have you swallow, Anthony? Perfect. So when swallowed, patient's trachea is still midline and there's no abnormal masses or pulsations noted. Okay, perfect, Anthony. Now we're gonna go ahead and do a general summarization. So summarizing everything, patient looks healthy. Patient has no lesions or abnormalities noted throughout his face, ears, neck, or throat. And patient denies any pain with any of the exams. So do you have any questions for us, Anthony?
I do not.
Okay, perfect. So I want to thank you for allowing me to assess you today. And if you do have any questions, you just let us know, okay?
Alrighty, thank you.
Okay, thank you.